The new scanner that our office has is the Trios scanner, which is a colored scanner, and when it takes the impression of the patient's mouth virtually, it captures all of the shades of the teeth, so that when the final crowns are made for the general dentist, they can communicate via email the exact shade that was captured by the scanner. The reason that we got the Trios intraoral scanner is not really to make my life easier or the staff's life easier, but rather to make the patient experience easier, better, faster, and more efficient. And it starts with scanning in the mouth, the way the patient comes in. And by scanning the patient's initial mouth, we can then rescan it once the implant is placed. And this type of information can be used to allow the implant crown to be made for the general dentist, who is our referring doctor. And when the patient sees the general dentist, the crown can be already fabricated for them to go ahead and insert. The whole point of allowing this type of technology in the office is to make the referring doctor and the patient experience better.
The normal procedure for the crown, I would have to go back to my dentist, get impressions, wait for that to go to the lab, come back, get it fitted.
With the technology and the way everything's going to fit, it's going to feel better and it's going to be done correctly.
The fact that I could have the digital impression done the day that my implant was put in was very convenient for me. I think it was convenient for my dentist, and it also saved me from having to have the tray put in my mouth with the material that I can imagine doesn't taste very good, and saved me a lot of time, which is very convenient.
Having a more digital workflow, which has been the wave of the dental future, so that we can get away from using impression materials, we can get away from pouring models and putting teeth in mailboxes. Instead, this is emailed, it's all virtual. The computer can make the teeth. The shade matching is able to be done with the actual scanner itself. So rather than having a shade guide and putting all of these tabs next to a tooth to try to figure out what color it is, we can let the computer do it. And then once we have the information, it's emailed so the laboratory can begin working on the final crown.